My main objective with each patient is for them to understand what's happening in their body, and they know what will happen if we treat it, and they know what will happen if they don't treat it, so they can make an informed decisions about their life they want to have and how aggressive or not they want to be with their health and their disease. I wasn't sure that medicine is what I wanted to pursue when I was growing up. I actually grew up playing tennis, thinking I was going to be a professional tennis player. What inspired me to pursue a career in medicine, I think a lot had to do with my dad, who is a general cardiologist in Colombia. He's been practicing over 35 years. The main reason I like cardiology is because he has a little bit of everything. So I think depending on where in the spectrum you want to practice, you can find things that are interesting to you and where you can help people. So it goes all the way from primary care with behavioral modifications and lifestyle management, all the way to changing valves and doing fancy MRIs. So I think, I like that breadth that cardiology has. One of the honors we have in cardiology is meeting people over time. I personally think that the best way to build a connection with your patient is to get them to know them as a person first and as a patient later, and then after that try to get into why they're in the office and how we can help. In cardiology, we treat a variety of things. I think the most common ones are things like coronary artery disease or heart failure, different types of arrhythmias, valvular problems, things like aortic stenosis, mitral regurgitation. But we also see some other less common things like congenital heart disease, patients who had operations in the past or maybe recently diagnosed. Cardiology has changed dramatically within the last decade or 2 decades. Now patients get an ultrasound of the heart, an echocardiogram, and we know what's going on, and MRIs of the heart when we can quantify exactly how much a valve might be leaking or not. It's exciting, and it makes you feel that you're doing the right thing at the right time. As doctors, you have that opportunity to actually touch people's life in real time, and when you just see your patient walking faster, they can do the things they want to do, then it all makes sense. If you care about your patients and you think of them as your family and as your close friends and that you really want the best for them, I think you will be a good doctor.